So you fell and injured your eye, yeah? Oh yeah, I can see it's a bit swollen. When did this happen? Okay. Did it swell up like this right away? Okay. Okay. Have you been having any sort of diminished eyesight? Your vision blurry at all? Okay. How about any light sensitivity or lights like streaking across your vision? Okay. Okay. And have you been experiencing any sort of loss of consciousness or dizziness, confusion at all? Okay. Just something we like to rule out with head injuries. How about any nausea? Okay. Yeah, I'm ruling out symptoms of a concussion. Okay. Well, we are going to take a look at you. I'm just taking a look really quickly at your history, which you wrote down on your paperwork. Okay. So, first thing I want to do before we go any further is I'm going to be administering for you some numbing eye drops, so that way we can go about this exam without you experiencing a lot of discomfort, okay? Yeah, they don't sting at all. They do take a couple minutes to take effect, but it just feels like a saline eye drop. Sorry, it always makes me giggle when gloves make that sound. Okay. Drops here. So I'm going to just tilt your head back, okay? So very, very gently. Just like so. Okay. And wonderful. If you have my double chin. Right. Sit those down. So try to keep your eyes open for me, okay? Like that. Good. Blink a couple of times. Okay. Other side. The first one came out without warning. Okay. Blink for me. Good. That should kick in just a few moments. You can lower your head. And let's just dab the drips here with that tissue. So eyes are just stuck. Garbage. Alright. So while we're waiting for those to kick in, I'm just going to do a test with a light that doesn't involve any sort of physical contact, okay? So I want you to keep your eyes open for me, okay? And just look right at my nose. It's totally okay if you need to blink. I just want you to keep focusing right on my nose. Good. Okay, you're doing great. Excellent. Okay. Alright, so keep looking at my nose. I want you to tell me how many numbers you see in each hand, alright? Excellent. Good. Okay. Now I want you to do that. Okay, we're gonna cover one eye. Right, I want you to do that. I want you to tell me how many numbers again while I cover one of your eyes, okay? So, just like so. Keep looking at my nose. Yep. Good. Good. Excellent. And the other side. Good job. That was great. You got all of them correct. Okay, so then, oh come on. Okay, with both eyes to start, we're going to test the motility of your eyes. So, look at my finger. Look at my finger. And then follow it. Good. Look at my finger. And look at my finger. Follow. Good. Okay. Look at my finger now. Excellent. Look at my finger. Look at my finger. And follow. Alright. So now with one eye closed, cover. Look at my finger. Look at my finger. Follow. Good. Other side here. Look at my finger. And look at my finger. And follow. Okay, so that looks good. That appears that in terms of the ability of the muscles of the eye to follow and move, it's intact. How did that feel? Did it feel like your eyes were straining when you were having to look in different directions? You're not sure. Okay. Not a problem. Well, come on. I'd like to check really quickly to see if your eyes are numb yet, okay? Okay. Just gonna lightly tap. Is that okay? How about the top? Any pain? Okay. Press a little harder. Did you feel that? How about there? Okay. Here. Okay. Then if it is okay with you, I would like to do a physical exam of the eyes and the structure around it, okay? Just to make sure that there's no sign of displacement of one of your eyes, no injury such as a fracture to the orbital structure around your eyes, as well as any sort of corneal damage, which we'll get to. But first I just would like to just take my thumbs very gently and do some retropulsion testing where I'm going to be pushing on your eyes and checking that the firmness between each of your eyes is equal. Alright? Okay. If at any point you feel this and it's uncomfortable, I want you to let me know right away, okay? So, I'm going to place my hands on either side of your face, okay? And you're going to feel me pressing, like so. Is that okay? Now I'm going to be feeling the supraorbital rims, the structures around the eye, and just looking for any sign of any kind of fracturing notch above the eye. Definitely feel the swelling on one side compared to the other. This is okay. There's no tenderness when I feel with my fingers. Can I have you open your eyes and look to the right for me? Good. And then look to the left. Okay. You can close your eyes again if you'd like. It'll probably be more comfortable. So I do feel the swelling and edema in the one eye. I am not feeling any sort of sign of fracture on palpation, but that doesn't mean that there's not something there, okay? It just means that on physical exam, I'm not able to identify it. Okay. So now we're going to test for red desaturation. Okay, so I have a red pen light here, and I'm going to cover one of your eyes. All right. So, what color is that? And is it brighter here or brighter here? Okay. Brighter here brighter here. Okay. Brighter here. Brighter here. Okay. This side now. Is this the same red? Okay. Brighter here. Brighter here. Okay. Brighter here. Brighter here. How about here? Or here? Okay. So now I'm going to span the light across your vision, and I want you to tell me if it gets brighter at any point. Okay. Okay. All right. Okay. So you would say equal. Okay. Now we're going to do something similar, only this time we're going to do it with just a regular white pen light. So now we're testing for brightness, desaturation, okay? I'm going to cover your eye again. Okay. So, brighter here or here. Okay. Here. Here. Okay. Here. Here. Okay. Switching eyes. Brighter here. Or here. Okay. Here. Or here. Okay. Here. Or here. Right. And then same as with the red light, we're going to have this span across your vision. I want you to tell me if it gets dimmer or brighter. Okay. Okay. All right. Okay. Excellent. All right. Now I'm going to be using my exophthalmometer. I'm going to be looking at the placement of each of your eyes, and again, different tests to make sure that there is no displacement of one of your eyes. Sometimes these changes can be very subtle. So, I'm going to be wearing my magnifying glasses. which they're a little funny, yeah? And, okay, I'm going to be holding up this ruler down to lining it, just like so. Okay. And we're just taking a look here at each of your eyes. Making sure there's not a change. I have to look very closely because even a tiny fraction of a millimeter can provide us with a diagnosis. You doing okay? Place this above your eyes now, okay? Just like so, okay? Okay. No, don't get stuck. All right. So I'm not seeing any sort of meaningful difference there either. So that is good. Okay. So now what I'd like to do is we're going to do an orbital ultrasound, which is going to be an ultrasound of the area around your eyes, which is going to give us a better picture of whether or not there are any sort of fractures in those structures, okay? Because you're numb, you shouldn't feel anything beyond just a little bit of pressure. So, first things first though, I do need to step over and turn on my computer program. So, sit tight first, isn't it? That is turned on. I'm just going to be positioning your head slightly towards me, just like so, okay? going to take some conductive gel. Very lightly just rub it around. Yeah, close your eyes, please. Center. All right. I do recommend keeping your eyes closed for the entirety of this process, okay? Okay. So, I'm gonna feel a little bit of pressure here. Taking a look here at my screen. You're doing great. This is okay anyway. It's okay with the pressure. I definitely don't want you to be experiencing any kind of pain here. Just want to make sure that everything is intact. just a little more gel, okay? Don't worry, we'll clean all of that up. I'm not gonna have you leave here with a bunch of ultrasound gel in your eyes. Okay. You're doing great. I'm just being really thorough because I don't want to miss anything and then have you go home and have a problem. I might turn it like this. There we go. Okay. I think we've got everything I need for that. Let's get you cleaned up, okay? Don't open your eyes yet. Let's get one more tissue. then now that we've done that and put some pressure on your eyes, I'm going to check again with the light. This time, first tips. I'm just going to be looking at your eyes, so you don't need to do anything. Just try to keep your eyes open as much as you can and stare straight ahead at me. Can I have you look to the right for me? And to the left. Look up. Yep, just pulling your lid up just a little bit. Look down. And look down. Your eyes open. Okay. Keep them open. Just making sure the light reflects off the cornea, which it looks like it does. So that's good. pressure on the eye. So to start, both eyes together, I just want you to follow the light. One eye covered. And the other eye. Did great there. Any strain, discomfort, looking in any particular direction? Okay. Then let me know at what point, if at any, that this light gets brighter as it spans across. Okay. A little lower. Okay. And higher. And if we change directions, okay. Okay. So then, later, or brighter here. Brighter, or brighter here. Brighter, or brighter here. Okay. Brighter, or brighter here. Okay. So, no changes that I'm able to discern. How about you? Okay. Well, then we're going to do one last exam here, which is tomography. Not most people's favorite, but it is very important. So, I'm going to be using my tonometer here, my tono pen, to basically put a little bit of pressure on the cornea, and we're looking to see if there's any sort of corneal damage. Okay, so I'm gonna feel a little puff of air. I want you to keep your eyes looking directly at me, your forward gaze, right? So to start, close to your eye. Okay. The other side here. All right. And on this side. The other. So now we're going to test your upward gaze, so let's have you look up. Okay. Okay. we're not seeing any abnormalities there either. So, oh yeah, let's dab those tears off. It's not uncommon to have watery eyes with these tests. Totally understandable. Like I said, I'm not finding anything conclusive. However, due to the amount of swelling, sometimes with a lot of inflammation, it can be hard to get an accurate diagnosis. Sometimes we need to wait for that inflammation to decrease. So what I'm going to do is prescribe you an anti-inflammatory that's a little bit stronger than what they have available over the counter. It is very important that you take this with food, okay? Otherwise it can give you quite a bit of an upset tummy, which we don't want, right? I'm also going to be prescribing you some eye drops just to make sure that we keep the eyes really nice and clean. I'm not seeing any sort of injury to the lacrimal ducts on exam, but I'd still like to keep them nice, clean, and hydrated. Just because when that inflammation does go down, we might see some changes. So this way we'll keep your eyes nice and protected. But I don't feel any injury to the supraorbital structures surrounding the eyes. I'm not seeing any sort of injury on ultrasound. So I think that we can rule that out. Okay. So let's get you a prescription written up. Okay. So I'm seeing here in your paperwork you put your pharmacy is Costco on 36th Avenue, correct? Okay. Just want to make sure that we get everything called into the correct place. Okay, so So both of these I'm going to be having you used twice a day, alright? So in the morning and in the evening before you go to bed. Preferably with dinner in terms of the anti-inflammatory. For the remainder of the day, if you start feeling your eyes becoming dry or itchy or irritated, you can just use an over-the-counter saline drop into the eyes, okay? It's really important though that you keep them nice and clean and hydrated. So then I'm just going to take a quick note here about what we've done. I don't know where the summer has gone. It has flashed by so quickly. Okay. So, alright. We'll get these prescriptions called in for you right away, okay? Usually, pharmacies are pretty quick about filling these. They're very common medications, so they should be on hand. And then on your way out, I would like you to stop by the front desk and schedule a follow-up appointment for 1 week out. So that way we're able to reassess once some of that inflammation and swelling has gone down, and we're able to see more clearly what's going on. Okay? Do you have any questions for me before I step out? If there are any kind of changes before then, give my office a call and we will get you in same day. I will let the front desk staff know that you are a priority patient and that I want to see you right away if there's any kind of change. Yeah, it's no problem. It might mean that you have to wait for a little bit if there is a full schedule of patients that day. Regardless, we'll get you seen. Promise. Any other questions? Okay. If you happen to think of anything, give me a call. I always return calls the same business day. If it's in the evening, we have an answering service. And if it's urgent, I can always be paged. Okay. Well, it was great to see you despite the circumstances. And we'll talk really soon, okay?